We have 47 cases and 8 deaths as of 5 this afternoon.
So at this point, I think we have to believe this is respiratory. Maybe fomites, too.
What's that, fomites?
It refers to transmission from surfaces. The average person touches their face 2,000 or 3,000 times a day.
2,000 or 3,000 times a day?
3 to 5 times every waking minute. In between, we're touching doorknobs, water fountains, elevator buttons, and each other. Those things become fomites.
Is this something we want to release to the press, respiratory and fomites?
And how's the public going to react to that?
It's hard to say. Plastic shark in a movie will keep people from getting in the ocean, but a warning on the side of a pack of cigarettes will
We're going to need to walk the
corner
governor
store
through this before we start to freak
find
everybody
more.
out. I mean, we can't even tell people right now what they should be afraid of. We tried that with swine flu, and all we did was get healthy people scared. It's the biggest shopping weekend of the year.
I think we need to consider closing the schools down.
And who stays home with the kids? People that work at stores, government workers, people that work at hospitals. When will we know what this is? What causes it? What cures it? Things that keep people calm.
What we need to determine is this. For every person who gets sick, how many other people are they likely to infect? So, for seasonal flu, that's usually about 1. Smallpox, on the other hand, it's over 3. Now, before we had a vaccine, polio spread at a rate between 4 and 6. Now, we call that number the R0. Once we know the R0, we'll be able to get a handle on the scale of the epidemic.
So it's an epidemic now. An epidemic of what?
We sent samples to the CDC.
In 72 hours, we'll know what it is, if we're lucky.
Clearly, we're not lucky.
And give me 2 milligrams of Ativan, please.
So, despite all our efforts, she failed to respond.
Okay.
And her heart stopped, and unfortunately, she did die.
Okay. Can I go talk to her?
Mr. Amoff, I'm sorry. Your wife is dead.
It's mutated.
Which way, better or worse?
It's moved into an African HIV/AIDS population. The Durban cluster is highly divergent.
The mortality rate is fluctuating between 25 and 30%, depending upon underlying medical conditions. And without a vaccine, we can anticipate that approximately 1 in 12 people on the planet will contract the disease.